Welcome, everyone. Great to have you all for this month Health Talks with Experts. I'm truly grateful to each and everyone for joining in. Yeah, it's a special, very special occasion also because it's been 5 years we have started this platform, Health Talks with Expert, and I'm so grateful that you all are here. And immense gratitude for taking time out on Sunday evening. You could have been simply lazing around sleeping, but yeah, you are here, and that shows that yes, you are committed to learn more and being more fitter and healthier. Thank you so much. And this episode of Health Talks with Experts is very special as we have for the first time a very special guest panelist with us. And I want to certainly very quickly going to introduce you all. So we started in June 2020, and today, this month is May. So we are almost at the end of the Health Talks. We created this platform to bring experts from health and wellness space to share their knowledge and wisdom, and thus help people to overcome their health challenges. Successfully running, this is, of course, we are going to start now, fifth year, 2020, 21, 2, 3, 4. Yeah. So we'll be starting a complete new year from June. And those of you who do not know me, I'm Yuktiraj Kishore. I'm a breathing fitness expert, a wellnesspreneur, and from Bangalore. I have founded Yuktanas, and we have a beautiful community of VA. Those who are my community member, just message me here, VA, WAH, so that I know that you are already here. And those who are not yet, it's okay. You can just message me here, NY. So I'm certified in various breath modalities that I have learned from Europe, Slovenia, Bali, a lot of places outside India as well as inside. Also, I've got certified and experts in various fields. Now, I would like to introduce, without any further delay, our today's panelist, Dr. Vishwajith Moorthy, who is a renowned pulmonologist, and he has finished his MBBS from JSS Medical College, Mysore, and DNB Pulmonology from Mahavijay Hospital, Vasantnagar. He's currently in charge of ICU and Department of Pulmonology in Shekhar Hospital, Bull Temple Road, and he's a consultant pulmonologist at a very renowned hospital in Bangalore, Sagar Hospital. He's also a visiting consultant in Nirmaya Specialty Clinics in Akshanagar, and his interests are asthma, tuberculosis, and interstitial lung diseases. Thank you so much, Dr. Vishwajith. And yes, your hobbies are reading and listening. And I'm gonna bring you here on screen. Everyone, please welcome Dr. Vishwajith. I'll just bring him here.
Hello.
Welcome, Dr.
Hi,
Vishwajith.
Yuti.
Great to have you in
Yeah,
today's
first
Health
of all,
Talks with
congratulations on your
Panelist.
fifth year.
Thank you. Thank you so much.
Yeah.
Thank you. Great to have you, Dr. Vishwajith. We would like to know, everyone, please message here. Welcome to our renowned panelist. Yeah. Jaldi se, first of all. Yeah. So
Thank
I
you.
would
Thank
say
you so
that,
much.
yeah, for the first time, in fact, yeah, we have got a lot of coaches, not for the first time, but yeah, it's been quite a long time. We have brought a doctor here on our platform. Usually, a lot of times coaches have been coming, and it's an honor to have you. Thank you so much for taking your precious time out today. I know it's a very hectic week for you, and we have connected before also. Thank you so much, Dr. Vishwajit, for taking time out. And I found you very humble and, really an honor to have you here today. So yeah, you
Thank
can
you.
go ahead and you can talk about today's topic. And in between, we will take up question answers also. So we will have a Q&A
Yeah.
also. If anyone has any questions, you can also ask. Yeah. But yeah, the stage is all yours.
Yeah. Okay. First of all, thank you, Yukti, for inviting me and having me over. And thank you, everyone else, for joining the talk session. And yeah, this is Yukti's for 5th year running, and all the best to you, and great success to your future endeavors also.
Thank you, Doctor.
And coming to today's topic, busting asthma myths and facts. Recently, we had our World Asthma Day on
Yes.
last week, and uh, this year's asthma, what do you say, slogan was Asthma empowers and educates. There are a
What
lot
was
of
it? What is the
myths
slogan?
about
Can you repeat? What is the slogan?
this year's slogan was Asthma empowers and educates.
Okay. Asthma empowers and educates.
See, we
Okay.
have a forum. Yeah, we have a forum for asthma, International Forum for Asthma, global initiative for asthma. This is called as GINA, GINA.
Okay.
So every year they bring out new guidelines, they bring out new slogans, and they have a lot of informative articles as well as videos on their website. It is, I mean, primarily a European website, but it has a lot of Indian inputs also. So they keep on educating people regarding the asthma. So first of all, let's understand what is asthma. Asthma is also commonly known as bronchial asthma or wheezy bronchitis or just plain wheezing for everyone else. It is an inflammatory disease of the lungs, primarily the large airways. So lungs, as we all know, has the tubes for airflow called as the large airways, as well as smaller airways called as bronchioles. Then going further down, we have alveoli. Alveoli are the basic air sacs where the gas transmission happens to the blood, from the blood to the atmosphere. So asthma is primarily a disease of the airways. It doesn't concern with the smaller airways as well as the alveolus. So the primary problem with asthma is it is an inflammatory disease. Inflammation is different from infection in the sense infection needs an external organism to initiate the inflammation from our body, whereas inflammation is de novo. It happens in our body because of certain genetic conditions or atmospheric triggers. So some people have innate atopy, that is, they have innate predisposition for inflammation, and some people need external triggers for inflammatory processes to happen. Innate triggers like stress as well as lack of sleep or anger itself can lead to asthma because of the stress hormones which are released. External triggers like dust or commonly pollen or animal dander, animal hair, these are the very common external triggers. So when the triggers reaches the airway of the concerned person, there are certain cells in the airway which receive the signals called as reactive cells like eosinophils or basophils. They sense the presence of the external triggers and they relay the input to the blood cells. So in this way, the inflammation starts happening, and within a couple of minutes or maybe half an hour, the trigger is throughout the lungs. The patient will develop excessive mucus secretion in the tracheobronchial tree. They have excessive inflammation or swelling of the airway, and they will start having cough. Primary symptoms of asthma are, as we all know, it is cough, starting with cough, and it will also lead to wheezing. In everyone, there need not be the regular symptoms of wheezing. There can also be atypical symptoms like chest tightness, feeling of uneasiness, feeling that somebody is sitting on your chest, or unable to complete a sentence. And in some people, there will be external audible wheeze. So the wheeze is nothing but a whistling sound when air passes rapidly through a narrow tube, just like your regular whistle. So the wheeze is the primary problem of asthma, because asthma itself should not be a life-threatening disease, because we have a very good pharmacological treatment available where it should not be a life-threatening disease if treated very soon. So when the person has an asthmatic attack, they will start to have cough, breathing difficulty, chest tightness, suffocation feeling, and sometimes with their regular medication, it will go away on its own. In very few cases, because of the excessive mucus secretion, they will start having secondary infections. So that is the issue with asthma. Then coming to various types of asthma, there are childhood wheezers who have asthma from the childhood itself. Initially, they will be labeled as wheezy bronchitis or wheeze with low respiratory infection. Then they will go on to become adult asthma patients. Around 80 to 90% of childhood asthma patients, they have a remission by around 12 to 14 years of age. Very few children go on to develop adult asthma. And asthma can also be, it can de novo occur in adults also. For example, in cities like Bangalore and Mysore, where we have a dense foliage and we have quite a bit of pollution issue. Patients, people from outside Bangalore, when they come to Bangalore, they can have a wheezing episode, which will be relieved from traveling out of Bangalore. That is one type of patients we look at. Then uh, coming to myths and facts about asthma, which is the today's topic. So what I have given you is a brief overview of what is the exact nature of asthma and what is the types of asthma, and we will further talk about treatment aspects in the later stages. Uh,
Sure.
we can, coming to the facts and myths about asthma, we'll start with some of the myths and we will discuss the facts along with that. So, some of the popular myths of asthma is you get asthma attacks if you drink curds, if you drink milk, or if you have daily head bath. No, that has nothing to do with asthma. Uh, if you develop a infection because of viral infection, because of the seasonal rhinitis or seasonal bronchitis, that can definitely lead to asthma exacerbation. So an exacerbation is an episode where you have exaggerated symptoms of your regular disease, like increased mucus production, increased fever, increased chest tightness, where it is more than the normal occurrence. So that is the definition of exacerbation. So the exacerbation can happen in certain seasons, which is in probably during the rainy and the winter season for most of the people, and few people will also have exacerbation in the summers because of the increased dust uh, aerosolization into the atmosphere. So because of food, very small quantity of asthma patients get triggered by food. I mean, it's not unheard of, but eating non-vegetarian food can trigger is one of the common myths. Eating fried food, no, those are not the uh, very common factors which involves asthma exacerbation. So second, very commonly what we find is running or doing physical exercise can increase the asthma attacks. Actually, doing regular physical activity, doing regular breathing exercises can help ameliorate the symptoms of asthma, and it will also give you the uh, how do you say you will know your breath better, and you will be able to assess the asthma symptoms more accurately, and you can take appropriate action. And doing regular physical activity can help ameliorate asthma symptoms. Your lung capacity will improve, and you will be able to expectorate and clear up your secretions very effectively. Uh, Third common myth is playing with animals, and uh, that will lead to asthma exacerbations. So again, yeah, as I said before, animal dander, animal hair, these are very potent triggers for asthma only in patients who are sensitive to those proteins. Because we have so many asthma patients who have pets with them throughout their life. They don't have very frequent exacerbations. But some asthma patients who are not exposed to animal protein, when they are exposed to an animal, like if they visit a park or a zoo where they're exposed to animals, they get triggered very easily. So again, it depends on your immune system. We have a hypothesis called hygiene hypothesis in asthma. This one, uh, how the asthma phenotype starts. So the basic principle is, if you are exposed to more number of proteins or allergens in your childhood, like if you play outside a lot in your childhood, so your body will be building up your immune blueprint in that age group. So the more you are exposed to a lot of allergens, a lot of animals, a lot of dust in your childhood, the sturdier your immune system will be. But in some cases where we see the children are very isolated, they play only indoors, they don't get exposed to a lot of outside world, they are more prone for asthma. And some of the facts in asthma, uh, smoking in pregnancy can lead to the child developing asthma phenotype. Then premature born babies, they have more number of asthma tendencies. And of course, children of parents who have asthma, they also have a higher tendency to develop bronchial asthma. Then one of the major factors of worsening of asthma are, one is the air pollution. Second is progressive exposure to persistent antigens. Like if you are situated near a large park or a garden where you are exposed to constant, exposure to pollen or dust, so the treatment of asthma will be a difficult one. Second thing is, when you know that you are exposed to when you know that you are allergic to animal dander and still you get exposed to animal proteins or animal hair, then control of asthma will be difficult. Then that is the common myths what we see across in our clinics regarding the asthma development, asthma progress, asthma treatment. And there are some myths regarding the treatment also that I will talk about during the treatment aspect. Have you guys heard of any other myths from different from what I have shared? Just let me know in the comments, or we can take it up in the Q&A session. Then, if it's okay, we will talk a few minutes for regarding the asthma management. Is it okay? Can everyone hear me?
Yeah, can you all hear us?
I hope everyone can hear me.
Yes? Okay, thank you. So we are having
Dr. Ali Surti, asthma goes away with death only, which is intrinsic asthma goes away with death only. Okay, that is one myth. Yeah, asthma is quite treatable. The diagnosis of, sorry, the definition of asthma itself is it is a treatable and preventable disease. It doesn't mean you have to suffer uh, throughout your life with asthma. With proper precautions, proper medications, proper lifestyle changes, you definitely can be in control of your asthma. And we have, uh, I mean, for asthma patients, we give a lot of leeway in managing their own disease. For example, we have something called as asthma control test or ACT, where we give prepared questionnaires, pre-printed questionnaires to our patient, where they have to jot down their symptoms, they have to jot down their, uh, I mean, the situation where they were exposed to allergens and where what was the for that exacerbation. Based on that, based on the symptoms and based on the severity of the disease, they can change their own medications without going to the hospital. Only even in uh, inadequacy of response to the medication, they have to go to the hospital, or we have certain protocols where they uh, they have to contact their healthcare provider immediately. Like if the saturation falls down, oxygen saturation falls down, or if they're not able to access their regular medication, or if they're not able to speak a complete sentence without falling short of breath. So those are the emergency situation where they have to contact their healthcare provider immediately. Then there are certain investigations uh, where certain investigations where what we need from our asthma patients. So one of the few well-known investigations are chest X-ray to make sure that there is no other diseases lurking around in the guise of asthma. Because one of the most common disease which can mimic asthma is tuberculosis. They also have constant cough, breathing difficulty, along with a couple of atypical features like fever and weight loss. So many patients mistake their infection for tuberculosis and they miss out on coming. And once we get a chest X-ray done, it is very obvious that it is not asthma and it is an infection which is lurking in the lungs. Also, certain medications what we give for asthma will have to be withheld or we have to reduce, like steroids in case of asthma. In if we diagnose or we suspect an infective process going on. So X-ray is a very basic tool. Second is the ubiquitous complete MRI, which will give us the idea regarding the WBC count, which denotes infection, bacterial infection, for example, and the eosinophil count, if we suspect a large amount of inflammatory process going on. Third thing is the pulmonary function test, or PFT short form, which is available in almost all the labs. There we ask our patient to blow into a computer, which can measure which can measure the patient's vital capacity as well as their lung function can be measured very accurately. So that lung function test will denote the severity of the asthma, and if we repeat it, we can see the results also with the treatment. So these are the basic investigations which are required. And coming to the predisposing factors for asthma, predisposing factors means the factors which make people more prone for asthma. As I have already shared a couple of examples, like uh, parents with asthma, they are the most common. Second is smoking during pregnancy and premature delivery, and childhood respiratory infections like tuberculosis or ARDS, uh, respiratory distress syndrome. So these type of patients have a compromised lung function from the childhood itself. So they will have more predisposing factors for asthma. They can develop reactive airway disease or asthma anytime in their life. Second thing is what we see commonly is obesity. Obesity and airway hyperresponsiveness or asthma is intricately linked. Airway hyperresponsiveness is very, uh, I mean, closely linked with obesity. What we have seen is asthma patients, when they reduce their weights, their exacerbation rates go down significantly, and the ability of the person to withstand the exacerbation and to come out of it sooner is increased very much, and they need a relatively lower dose of medications for the asthma control, and it is backed up by studies also. What the studies have shown is obesity predisposes to GERD, GERD, gastroesophageal reflux disease, and that can trigger asthma very much. So these are the common predisposing factors. Also, the common exposure to animal dander and exposure to pollen, they are very common. And I will, I'm seeing a couple of questions regarding IgE level. Yeah, IgE level can be reduced, but only with certain medications. And PCOD, there are no definitive researches where PCOD is related to asthma. I mean, it's not proven as such. Okay. And coming to
Yeah, what is
medical management,
IgE level, Vishwajit sir? Can
yeah,
you please
IgE is an immunoglobulin level. There are a lot of immunoglobulins in our body. IgE is specifically linked for asthma patients where the levels are more than 800. It indicates, I mean, airway hyperresponsiveness or increased allergic tendency in the body. It can be elevated in many other conditions like tuberculosis. It can be increased in parasitic infections of the stomach or the intestines. So it is a correlating investigation where we have to take it with a pinch of salt. Coming to management of
okay, you have also
bronchial asthma.
mentioned, yeah,
Yeah,
yeah. And there's one more question I see here. Lung detoxification can help. What is the best way to detoxify lungs?
uh, yeah, detoxification is a very aggressive term because the lung itself is the best detoxifying organ in the body. Lung and liver, they are the best detoxification agents in the body, along with the kidney, of course. I can't forget our kidneys. See, lungs basically take the polluted air from your body. It provides pure oxygen into the blood. It disposes of your carbon dioxide as well as other noxious gases outside your body. So we can't basically detoxify our body with external agents. What we have to do is we have to avoid smoking. That is the best detoxifying agent. Don't smoke. Second thing is pollution. I know you can't avoid pollution wherever you stay. There will be some amount of pollution. It's more in metros. It is less in tier 2, tier 3 cities, but you can't avoid it. As much as possible, wear a mask where you can avoid larger diameter particles entering your lungs. And getting the noxious particles out of the lungs is impossible, because once the larger particles enter the lungs, they can't go out, because that is the nature of the lungs immune system defense. It traps the noxious particles with a mucus layer. The mucus layer will spit out, I mean, it will come out outside through your day-to-day expectoration, day-to-day phlegm. I mean, when you bring out the phlegm in the mornings, but you can't detoxify in a I mean, very traditional sense. Just like the liver or the kidneys, they are the best detoxification agents. Then, yeah, cardiac asthma and a bronchial one. So basically, what Dr. Surti is asking is regarding the cardiac asthma. Asthma is congestion of the airway tracts, as I explained before. So that can happen in another condition where Dr. Surti has mentioned cardiac asthma. Basically, in cardiac failure, congestive cardiac failure, where the heart is not able to pump out enough blood into the left ventricle, the blood in the heart gets backflowed into the lungs. So that is called as congestive cardiac failure. In that situation, the excess fluid, whatever is there in the lungs, get sequestered into the lung tissue, where again swelling of the airways can happen, which can mimic asthma. Like they will definitely have wheeze, they will have breathing difficulty, they will not be able to complete a sentence properly. So, but along with that, they will also have very usually puffiness of face, swelling of the legs. They will have difficulty in lying down, called as orthopnea, because of the congestive cardiac failure. Also, usually these patients will have a cardiac history where they will be on medications for heart disease, or they will be instructed from their cardiologist regarding the fluid management. Okay, that is a different topic. Coming to management of asthma, first we will discuss regarding non-pharmacological management.
Hello.
Non-pharmacological means without any medications. So this comes under
Dr. Murthy, can
avoidance,
you hear?
principle of avoidance. Hello,
Your video is frozen, Dr. Murthy.
hello, can you hear me now? Hello, am I audible now?
Yes, you are audible, but not visible.
Yeah, I have just disabled the video. Probably the
Yeah, here.
bandwidth is not enough.
Okay.
Okay,
Okay. Yeah, we are having heavy rainfall in Bangalore. That could be the reason also.
yeah, yeah. Okay, so we will discuss briefly regarding
Okay.
non-pharmacological
Yeah.
management.
Yeah.
That is based on the avoidance
Sure.
principle. We just have to
Yeah.
avoid
Yeah.
getting exposed to uh, allergens. That's it. Simply avoidance of allergens. Don't get exposed to heavy dust or heavy smoke, or high degree of pollen, like going into the park for a walk. I mean, only for patients who have asthma. This is not for general advice. Second thing is, as much as possible, avoid your contact with animals, because animal dander and animal protein is a very potent asthma exacerbator. Third thing is, have your daily walk, keep your lungs healthy.
Hello.
Am I audible?
Your voice is your voice is breaking, Dr. Vishwajith. Your voice is breaking. Can you just repeat all the three things that you have just shared?
Yeah. Just avoid going into the park for a walk. Second thing is don't get exposed to
Okay.
animal dander, because animal proteins are one of the very huge culprits in asthma exacerbation. Third thing is don't get exposed to heavy smoke or heavy dust, like cleaning your home without a mask, or getting exposed to roadside smoke, or some people burn their trash in front of your home. So those are the kinds of asthma triggers which we can avoid. So some things can't be avoided, but that will not go through it. Pharmacological management includes medications called as controllers and relievers. Relievers are medications which can immediately cut short the asthma attack, like nebulizations and inhaled medications. And controllers are medications which are given once or twice a day to control the asthma, to reduce the inflammation going on in the lungs. Based on the factor that whether you're infected or not infected, your doctor can prescribe you a course of antibiotics. And based on the severity of the disease, he or she may prescribe you a course of IV steroids or a oral steroid. So that is completely based on your clinical condition at the moment of your visit. So what I would suggest is, if and
Hello.
when you have an asthma. Hello.
Yeah, yeah. You said that the course of antibiotics and what else you have
Yeah,
said?
and your doctor may prescribe you a course of steroids, either IV or oral, based on your clinical condition.
Okay.
And
Okay.
based on your clinical condition, they may ask you to get admitted also. So
Okay.
controller and reliever medications can be given through inhalers or nebulized form. So there is another myth which I mentioned in the beginning, was the myth regarding your inhalers getting addicted, you getting addictive to your medications, which is a very common myth. And the patients are very hesitant to take inhaled bronchodilators for their asthma management. They will feel that they will get addicted and they will have to use it for their lifelong duration if they start it now. Uh, what I say to them is, if the medication doesn't give you a high or any sort of pleasure, then it is not going to be addictive. So these are the very common practices what we do in management of asthma. And regarding the question by Ms. Meenu Garg, I can walk for 10 kilometers per minute. Huh. Yeah.
Yeah.
So that is
Yeah, so she has
basically.
asked that I can walk long like 10 kilometers easily, but
Huh.
feel very much breathlessness while climbing or walking incline. On every
Yeah.
203 meter, I need a sip of water. How can I improve this? Yeah.
So that is basically a deconditioning problem, where if you don't have any cardiac issue, you can just keep on increasing your day-to-day inclined training, and you can increase your climbing capacity. It is not unheard of, because day-to-day walking will be around in a flat surface. Climbing a stair or climbing an inclined surface is not a very common mode of transport. So if you're not accustomed to something, if you do it once in a while, you will get breathless. That is very common. So if you do it every day, if you do it in a progressively overloading step, so that is very easily achievable. Unless you have an issue where you need to meet your physician or a cardiologist to make sure you don't have any other medical issue. I think I have covered
Yeah,
the.
Meenu, you got the answer?
Yeah, I have covered the definition of asthma, the predisposing factors, the methods to avoid getting an exacerbation, medical and non-medical management, and very common myths regarding the management of regarding the bronchial asthma. Hope I was audible
Okay.
throughout the talk.
Yeah. In between we missed, but yeah, you have been so kind to repeat it. Thank you so much. So, one of the question that is coming into my mind is what
Yeah,
role does diet and nutrition play in managing asthma?
yeah. I mean, very excellent question. Diet again, we have to include. I mean, we have to include everything in our diet to make sure that you're not allergic to anything specific. As I said before, if we keep excluding some of the major part of the diet, like dairy products or nuts in the childhood, they may develop allergy to it later in the life. So, and if you start, uh, I mean, using everything in your diet, like dairy and nuts and everything, if you have an allergy to a particular food product, you will get to know immediately. So diet, I mean, I'm not saying that there is a particular diet which is beneficial for asthma, but general healthy diet, like including a lot of leafy vegetables and seasonal fruits, is the surefire way to control it very easily. Second thing is nutrition. Nutrition includes your high protein sources. At least 1 gram of protein per kg body weight has to be taken by everyone. In asthma patient during exacerbation, they have a lot of external, I mean, excess
You
requirement.
said 1 gram
So we of protein per kg per day.
per
So
kg
if a
per day.
patient,
One
if a
gram protein
yeah
per kg per day, right?
per day, yeah. So in a infection
Okay. So
situation,
any kind of food
patient
that we should avoid, general, avoid besides. So yeah, I have come across a lot of people, in when the elder generation, दूध मत पिलाओ या दही मत खिलाओ,
no.
dairy products avoid करने को बोलते हैं, usually if people are having asthma or wheezing issues. So it has nothing to do with
Yeah,
the dairy
no,
products,
no,
is
no, no.
that so?
No, yeah, because even in our practice, they themselves they will avoid having dairy products, saying that the kapha will increase, they will get more blockages or something like that.
Yeah, yeah.
See, one of the major problem with dairy product is lactose intolerance. That is the problem of the intestines, not the asthma component. If a patient has dietary intolerance, it will cause loose motions and diarrhea rather than asthma exacerbation. So dairy products in itself will not cause any problem, especially curds. Curds are a very good source of probiotics. You don't imagine how good it is.
Mhm,
Uh, it
mhm,
is a very good source of probiotics, which includes your gut health as well as your lung health. So we don't have any problem with
oh,
having curds or milk for that matter if you don't have lactose intolerance. Second thing is, I would suggest avoidance of outside fried food where they use repeatedly fried oil on and on for preparing things. So that will degrade the quality of the oil and it will increase the chances of getting a throat infection, which can further lead to asthma exacerbation. That is the only thing I would suggest avoiding. If you have to have something outside,
so
stick
repeatedly
with your
used
basic.
oil. Yeah.
Uh,
Can you just
yeah,
repeat what
repeatedly
did
used
you say
oil.
that if you
Yeah, repeatedly used oil will get degraded eventually because
what will
the
it do?
hydrogen bonds and the it will break down. It will break down again and again. See, oil is not. I mean, cooking oil has a high smoking point and can be used for a high degree of temperature. But repeatedly using it on and on, it will degrade the oil. it will form free radicals, it will form denatured bonds, so which is not very good for your health. Okay, so that is one thing I would avoid. That can frequently lead to throat infections and asthma exacerbations.
Okay. Thank you. Thank you. Is there any kind of exercises also they should be doing, and like do's and don'ts with respect to exercises, physical activity?
Yeah, once you have, there is also, yeah, I forgot to mention, there is also something called as exercise induced asthma, where you get asthma once you start doing a physical exercise like cardio training or weightlifting, where the high blood flow to your muscles will induce an asthmatic attack. So the treatment for that is taking your inhaler before going to the gym. Regarding exercise as such, we don't have any problem with going for your day-to-day activities, not a problem. But if you have an asthma tendency, even if you are in remission for a year or 5 years, keep your inhaler with you in the gym because you never know when you get an attack. It doesn't have to be a slow and steady increase in your wheezing. It can occur anytime, it can occur any place. So keep your inhaler handy with you and keep checking the expiry date for its viability. Regarding the types of exercise which you can do, swimming is a very good, uh, I mean, exercise to improve your lung capacity. It will increase your breath holding time. It will increase your chest muscle strength and stamina. Uh, Over and all, it is a very fantastic exercise if you know how to swim and if you have access to a good swimming pool. Second common good exercise is just walking, simple walking. Just put on your headphones and walk just for half an hour to 45 minutes at a pace where you can talk a few words without getting breathless. I mean, it should not be like you can keep on talking and walking. That is a very slow form of walking, but you should have at least 1 or 2 word capacity to talk in between. So I would suggest swimming or walking.
Okay.
And other forms of exercises like playing badminton or tennis, those are good cardio workouts, but these two are good for lung health.
How about yoga?
Yoga is definitely, again, that will improve your lung capacity along with pranayama and your your lung capacity as well as your chest muscle tone. Those are I mean, but the problem with yoga is you need to have a good instructor. You need to know what you're doing, or else you keep on doing some sort of exercise, it will not help you. So if you have access to a good trainer, that will be the best.
True. So we have a question here. Nowadays, they say hydrogen therapy is good for asthma attack. What are your views on
Hydrogen
it? And what is
therapy,
this hydrogen therapy?
I'm not very sure. I don't know. I've not heard of hydrogen therapy. But in severe asthma attack where the patient is in an ICU, we do use liquid. We use helium therapy for this one asthma patients. But hydrogen, we have not heard. I have to read upon it, and I'll get back to you definitely.
Sure.
And
And
Aparajita
another
Singh is
question.
asking
Yeah.
acidity. Yeah, definitely.
Yeah.
Acidity can
Thank you.
definitely trigger asthma because the acid reflux, acidity itself will not trigger asthma, but acid reflux, the acid which is produced in the stomach can go up your esophagus and come into your throat. That reflux, acid reflux disease can definitely trigger asthma because the acid itself is a chemical trigger that will trickle into your airways and it will create a chemical inflammation. So definitely it can trigger asthma. That's what I told in the obesity related topic. Obesity has a tendency to increase your reflux disease. So acidity can definitely trigger asthma. We have to be very careful regarding that.
Thank you so much for asking such good questions, Jagdish ji, Aprashta, Meenu, Dr. Onal. Yeah, any other question we have? Any other questions? If you have any other questions, please feel free to ask. So usually, what have been, if I ask you, Dr. Vishwajith, asthma can be maintained or completely can be cured? My question to you.
Huh. Asthma is unfortunately at this point of time not curable, but it can be very well managed as, as good as you don't have a disease, but with proper medications. I am not competent enough
You
to
said
talk
you.
about other specialties. Yeah,
Hmm? Yeah,
yeah,
you
I'm
said that
not.
as long as people don't have disease. What do you mean by that? Like, what all?
No, no, no. As long as they take proper medications.
Hello?
Yeah, again the network issue. Can you hear me now?
Yeah. Yeah. So my question was, asthma can be cured or maintained. So you
Uh-huh.
said that it can be very
So
well
asthma,
maintained if a person doesn't have any
as
other
long as
diseases.
no, no, no. As long as the patient is on proper medications. I mean, you got it right. I mean, if the patient takes their treatment very seriously and they adhere to the discipline, they can themselves manage it very well. They don't have to go to the hospital itself.
Mhm.
But if they lack
Mhm.
certain discipline, like they have to gargle after each inhaler or nebulization, and they have to take it in a proper
Mhm.
duration of time, they have to take it in the proper spacing, uh, and if they have to take their tablets properly during the duration of their attack. So if they do that, they can maintain it very well by themselves. They don't have to go to the hospital itself. But unfortunately, at this point of time, they can't be cured because it is an allergic disease where allergy cannot is a condition in your body where it is getting triggered from the external antigens. We are not able to cure allergy at this point of time. So until then, we have to say it is not curable, but extremely well manageable.
Okay. So, uh, if I ask you if a person is having asthma, so does
Yeah.
asthma limit the lifestyle that I can do this, I cannot do this?
No.
Um, so it does it
Ha
put
ha
any
ha.
kind of thing that,
Limits. Yeah,
yeah.
yeah. See,
So what is
for
it that you
example,
mean?
a
Yeah.
patient who is a cook or a chef, they will have certain restrictions because they should not be getting exposed to smoke day in and day out. So those kind of professions will get affected. For a average person, their lifestyle will never get affected when they are on proper
Hmm.
medications. So those are the type of person. I mean, the person who works in a chemical factory, for example, where they are exposed to a lot of chemicals, or a person who is working in an automotive industry,
Mm, yes.
if they wear regular air filters for the respirators, if they use proper precautionary measures, they will also be able to do their normal activities, day-to-day activities, no restrictions. People with asthma can have treks, they can have their normal trips, high altitude trips, they can do bungee
Mm.
jumping, not no restrictions at all.
Oh, okay.
Absolutely.
Nice to know. Here I'm a little curious about knowing a little bit about interstitial lung diseases also, because one of my students have come to us for, and he was having interstitial lung diseases.
Okay.
So I would also like to know a little bit about that condition. Um,
Okay.
and how people can, take care of themselves if they are having ILD.
Okay, interstitial lung disease is a very vast topic where the problem is the lung tissue will get stiffer and stiffer progressively. For example, lung is a very soft sponge-like organ where you have to completely expel the air out into the atmosphere and you have to completely take the breath in. This is the normal respiratory motion. But in patients with interstitial lung disease, their lungs will get stiffer and stiffer progressively. So as I told in the beginning, there is something called as alveolus in the distal part of the lungs, where the gas exchange is happening. I mean, the oxygen from the lung is going into the blood, and the carbon dioxide from the blood is coming into the lungs. So that barrier is called as interstitium. So that part of the lung will get fibrosed, that is getting scarred in this ILD throughout the lung. So first of all, the lung expansion is limited. Second is oxygenation of the blood is not happening. Third is there will be constant cough because of the inflammation of the interstitium. There are many kinds of interstitial lung disease. Some of them are autoimmune diseases. Some of them are infective, like in COVID pneumonia. So we had a lot of interstitial lung disease, which was treatable and curable. But some ILDs, which come in the form of autoimmune diseases, they are not curable, but they can be again managed, and we can increase their uh, uh, livelihood. There, we can increase their lifespan with medications. And but we need to know what is the type of the disease, what is the diagnosis, proper diagnosis as such. Probably we can do a different topic on that
Nice.
later.
Um, sure, sure. We'll do that for sure. I see two more questions here. How to overcome side effects of anti-asthmatic drugs, especially steroids?
Yeah, yeah, that is a very good question. See, as I told you before, steroids are lifesavers as well as killers. We know that, and we need to know that steroids are taken only with the prescription of your physician or a pulmonologist. So my suggestion is don't take any other medication except your inhaler without the prescription of your doctor, because steroids, if taken in the proposed dosage and proposed duration of time, because we usually give it on OPD basis for 3 to 4 days or maximum a week without causing any side effect. So chronic steroid usage, where we see a lot of patients, especially in rural areas, because if I prescribe a steroid now, they will start feeling better. So next time they have an exacerbation, they will not come to us, either because of the distance issue or some other reason. They will go to your local pharmacist and they will show the prescription, take the steroids. So it is very inexpensive medicine, steroids. But at the same time, if we don't monitor their usage, it can lead to a lot of side effects. It can lead to, diabetes. It can lead to heart disease. It can lead to hormonal issues. It can lead to fatal, stomach ulcerations. So under the prescription, under the supervision of your healthcare provider, it is a life-saving medication. If you don't use it as it is intended for, it can be a killer also. So side effects of steroids can be prevented by stopping the steroids, either immediately or in a tapering dose. We have to slowly uh, uh, I mean uh, reduce the dosage of the steroid medications, because we should not immediately stop it if it is being given for a longer duration.
Okay. So, yeah. So the question is also that how to overcome side effect of this.
That's
So
what
if
side
people are
effects of
having side
steroids.
effect, that's it.
Yeah, it depends on the side effects. If the patient has a infection, I mean, that can be treated with antibiotics after reducing the steroid dosage. Steroid side effects can be stopped only with stopping the steroids. No other way of managing it.
Hmm. Okay. So when we start steroids, do they still be having the side effect? Like your body is already
Or our body will
harmed?
start, healing itself once we stop the steroids. Unless, as I
It will
told,
take time.
yeah,
After
it will
a
take some
couple of,
time, but it will be handled. Unless you are using it
it
for
is,
years together.
it will take in for longer duration. And then of course,
Yeah,
sometimes if the
at least,
damage is done, like if you get some heart disease or diabetes because of the
huh,
longer
those are
duration
some
of
of the
taking steroids,
irreversible components.
right?
Yeah,
Yeah. 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 So we need to be very, very careful. And the
yeah.
other question that I see here is how helpfully is air cleaner? Yeah, very good question.
Uh, yeah, definitely cleaner air will lead to reduced asthma exacerbations. What we usually see is patients with asthma do well in coastal areas where the humidity of the air is on the higher side and there is less pollution compared to the metro areas. For example, people go to Mangalore or Visakhapatnam or Chennai, they get the exacerbation rate is very less in those areas, and they come to Bangalore and they will suddenly have a wheezing episode. So clean air is obviously the answer, but as I said, asthma is external as well as internal because even patients in Mangalore or Chennai or Vizag they also have asthma. So cleaner air is one of the major options, but it is not the only option.
Oh, okay. Any other question? If anyone has any other question, we can take couple, maybe one or two more questions. What a wonderful, full info packed. This session has been quite an eye opener. I've learned a lot of
Hopefully, it was
things
not too
today,
technical.
Dr. Vishwajit, from you.
Thank you so much.
Hello.
Hopefully, it was not too technical.
Hello.
Hello.
Yeah.
Yeah.
Please tell your name and keep your
Just by
video
breathing exercises, will we be able to cure
video on.
asthma over the course of time?
Again, ma'am, no. Breathing exercises can give you
Hello.
a good control of your asthma, but it will not cure asthma.
Because worried of the mucus that forms by itself. How
Yeah.
to get rid of it?
Mucus can be expelled out through
Rinaji, we
deep
can't
breathing
hear you.
exercises.
Hmm.
It can be cleared out with uh, deep breathing exercises and assisted coughing techniques. If you have a physiotherapist on hand, or if you can contact a chest physiotherapist, they will
Hmm.
teach you techniques to bring out the accumulated mucus through
Oh,
exercises as well as respiratory maneuvers.
oh,
Also,
thank
you
you.
can use steam inhalation for clearing up the
Ah,
mucus if it's getting
oh.
stuck inside.
Not stuck, but I always feel there is some little mucus
What did
there.
you say at the end?
Thank you.
Huh? Thank you.
Thank you,
Hello,
Meenaji. Thank you so much for asking this question.
hello,
Yeah. Anyone else has any question? Yeah.
hello.
Yes, Dr. Ganpa. I think you are the one asking question.
Actually, allergic
Can't see you,
asthma
Dr.
that
Ganpat. Yeah, now I can see.
allergic asthma that is dust or any
Yeah.
food. Generally, for the dust, my son is getting
Can't hear
asthma attack.
you.
Hello,
Yes, yes, yes.
Uh, are you hearing?
Yes.
See, my son is having
But
dust allergy, and he gets asthma attack. How it can be avoided or uh, getting the treatment for that? Because he was taking from childhood, he is having asthma. He was on the adrenaline inhaler, and also on Astelin he was there. But now any dust or anything small, this thing, he gets asthma and cough continuously.
how old is your son, Dr. Ganta?
Pardon? He is
How is your
20,
how old is
20,
your son?
24 years.
Mhm. Okay. So few things that Dr. Vishwajith, are you here?
But can you hear me?
Yeah, I can hear you
Yes.
now. Yeah.
Yeah. See, one thing is Astelin inhaler is a reliever. It is used only for emergencies. It can't be used as a regular medication for asthma. So inhaled steroids are the best form of medication for asthma, where inflammation is controlled in the lung itself. So those medication has to be assessed, and we can do a lung function test for him to know his lung capacity, and then based on his lung function, we can change the medication. And because 24 years of age is, I mean, they can tolerate, I mean, very well. They will do very good. But based on his lung function test, we may have to change the medication.
Now he is not taking, but he is getting now allergic asthma. And that time he was getting bulgum, and the cough was
Ah,
not controlled. So well-known pediatrician has given the inhalation adrenaline and asthma, and no other medicine was working. But now he has come out of that. But now,
yeah. See, adrenaline is only for emergencies. That
yes,
is only
sir.
for
But
emergencies.
no, emergency he took for 2 years, more than
Hmm.
2. But now is where we stay now. Any dust comes, because in
Ah,
Mumbai there is a pollution, as you said. In
ah,
Chennai and all
ah.
that, they are less.
Hmm.
I appreciate, but in Mumbai we cannot shift here. We are staying in Mumbai only,
Correct,
and
correct, correct, correct.
he,
Yeah.
he is suffering from the dust allergy or any cold, and he is not right. He is also he has completed MBBS, but nobody is giving treatment properly to this thing. Anything, then we have to put him antibiotic. Then
Again, see, I need
yes,
to
sir.
know. I need to know what is he taking. Only Astelin is not beneficial.
And now he is not taking Astelin. Antibiotic
Okay.
is
Okay, then
Just a
he,
sec,
he
Dr. Ganpat. I think it would be better if you consult the doctor later, because for I think this is a
yeah,
one particular
specific
case. It is better if the
consultations.
doctor knows the
Yeah,
proper
specific
history.
consultations are very
Yeah.
difficult based on a brief history. So either your local pulmonologist
Yes.
will be able to help
Yeah.
you, or you can have a video consultation with me later. Hmm?
So
Any
this
other
is I
questions,
would
Dr.
highly
Ipti?
recommend. Apart from that, having a good lifestyle. No, I think we are almost done. Yeah, we are done. There's no more further questions.
Yeah.
Thank you. That was a very, very wonderful session, Dr. Vishwajith. So yeah, if anyone is having any questions, I would like you all to connect to Dr. Vishwajith Instagram account. You can always connect to doctor, if you have your email ID or something you would like to share, then you can share that also, so that people can connect and they can fix their appointment or something. They can have a
I'll
consultation with you if
send the email
yeah.
address in
Yeah.
the chat
Apart from
section.
that, yeah. Yes. Please do
Any
that so that
queries
people can
can be sent either to Yukti or to me directly, so that we can I can address any specific issues you have.
yeah, you can Yeah, you can always, all of you are usually connected to us, so you can always send us on our official number and we will connect you to the to Dr. Vishwajit also. Otherwise, he has already mentioned here his
Yeah.
email that you can use, and jitu@gmail.com. You can
Yeah.
send, and then later you can certainly, have a word with the doctor. Yeah.
Done.
Thank you so much, Dr. Vishwajit. You can keep your video on. And everyone, please keep your video on. And this also is there on our YouTube channel. Everyone, please keep yourself muted. Give me a sec, I'll just. Dr. Vishwajit, you can unmute yourself.
Yeah.
Yeah, I've just muted everyone. Yeah, so this is there on our YouTube channel. So if you feel that you couldn't understand some of the part or you need to revise it, please go through this link I'm just sharing here. It's there on our YouTube channel. Please go there and you can please share it, because we see that people are suffering around us with a lot of asthma. Many of you are here also. So having the right knowledge will certainly help you. Having a right kind of lifestyle, and it is most what I could understand through the interaction is majorly that this is something we need to maintain. Breathing practices, yoga will certainly help you, but get the right guidance. That is very, very important. Otherwise, if you are a gym person, make sure that you don't do something that triggers your asthma. And,
Yeah.
uh, you know, I have also learned that taking inhalers is not addictive. That's the one thing. A lot of
Exactly.
things
Yeah.
I have learned. So kindly go through this video once again so that you can take out more information out of that and see how you can apply in your life. If you are one who is suffering from asthma, or someone is there in your family who is suffering from asthma, connect to us if you have some more further queries, and we will certainly help you out with that. So thank you so much, Dr. Vishwajit. And as a token of appreciation from our Wellness Abundance Hub community, I'll be sharing here with you this certificate. I'll just share here with you here. Uh, yeah, and I'll be sharing you as a certificate of gratitude from all of us, from our community. Thank you so much for taking time out and sharing your valuable knowledge with us as a panelist of Health Talks with Experts. Immense, immense gratitude, Dr. Vishwajit. And apart from that, we will be also sharing our app
Thank
with
you.
you. You will have Flow app. It's a wonderful app where for
Okay.
breathwork practices, breathing techniques. There are a lot of breathing techniques that are there that can really help people. And in our way, what I am connected to, that if you are having lung issues, it's a sign that you are not able to breathe properly, and that shows that you are also carrying a lot of stress. And this is the first thing I remember you have talked about. The very first thing that you have said, that people are having these all issues is because of stress. So how can
Yeah.
you release this stress through right kind of breathing practices? This is something that that's there in that app also. So
Good.
I'll share the subscription of that app also with you. So enjoy that, and I hope you would love it for sure. So thank you
Thank you.
all.
Thank
Are
you
you
so
all
much.
ready to do breathing practice with me? If you are ready to do some breathing practice, just message me here ready. So before, yeah, right way of breathing is everything. Yeah, most of the time we are so much involved in taking all the kind of, you know, medicines and everything, that we forgot that we too have the power to heal ourselves. Our body has a healing capacity on our own, and there are a lot of breathing practices. So today, with respect to this one thing that is through asthma, yes, a lot of things I have seen people improving with asthma using the breathing techniques, breathing practices. We must not forget practicing breathing the right way of breathing. But yes, please do consult. Today we will just practice pursed lip breathing. That has been a very foundational breathing practice, and it helps also people. If you can check my to overcome a lot of panic attack issues, you can say, and it also helps you in building your lung capacity. But the key is consistency. Here, the key is consistency, and this has been a game changer in my personal life also. So, if you are all ready, just keep your videos on when we will sit. So, how we are going to breathe is um, first and foremost, I hope everyone here knows how to breathe right. That means you inhale and allow your belly to expand. Exhale, belly goes in, and breathe out through your nose. This is one diaphragmatic breathing that he is doing. And the other thing that you can do is inhale and allow your belly to expand. Exhale, breathe out through your mouth. First lip exhalation and feel the warm moist air at the center of your palm. Inhale and expand. Exhale, belly goes in and breathe out. And feel the warm moist air at the center of your palm. This is, I would say, a one-stop solution for a lot of health issues. If you're someone who wants to train your nervous system to reset, if you're feeling, because what happens is we are usually very much stressed out. Stress is one of the root cause, as doctor has also shared that a lot of breathing difficulties, or overall also we know that the root cause of all the lifestyle related diseases is improper breathing. So if you are someone who is, so what we are doing is we are using our lungs here. The more you are expanding, the more you are training your lungs to improve their capacity, you can certainly improve your condition, asthmatic conditions, or any other different kind of conditions that you are facing in your day-to-day life. So inhale and your lungs expand. Exhale, lungs contract, but this time you're breathing out through your mouth. Why breathing out through your mouth? First is because we are controlling our exhalation, narrowed, controlled exhalation through our mouth. First lip. First lip means you are keeping a small hole and then breathing out through your mouth. Yeah. So everyone take position, keeping your right palm over your belly and above your navel button, another hand in front of your mouth, two fingers gap only. Inhale through your nose, allow your belly to expand, and exhale through your mouth, first lip exhalation. Breathe in through your nose and exhale through your mouth. In, two, three, four. Exhale, two, three, four. In, two, three, four. Exhale, two, three, four. In, two, three, four. Exhale, two, three, four. Breathe in, two, three, four. Exhale through your mouth, three, four. So yeah, practice this one very powerful technique. But before that, I would also suggest that just see how good is your breathing. That's also very important. What is your breathing pattern? But this one is a safer practice, I would say, that you can start doing. Start doing it slowly. If you feel restless, stop the breathing practice there and then only, and then resume. Please have a right guidance for your breathing practices. So yeah, I would like to know what have been your biggest learning through this session. What have been your biggest learning through this session? Please let me know in this YouTube channel that I have just shared with you, the YouTube channel. Can you all just go to this channel, everyone? Can you all just click this? Can you all just click this link? And please go to the YouTube channel and serve the purpose of this health talks by sharing what have been your biggest learning. So my humble invitation to each and everyone, Dr. Onali, Aprashta, Lakshmikant, Kushi, Darshan, Manikanta, everyone, that please go and Jagdish ji also and Dr. Ganpar. And now that you have learned something, go and revise. Repetition is the mother of all skills. So just go and share what have been your biggest learning. Thank you all. Link is not clickable. Okay, why it is so? Let me see. Is the link clickable for everyone in the chat box? Can you all just let me know? Else I'll share it in the group and you can share there also. So thank you all. This is Yuktiraj Kishore signing off. Thank you all. Please take care of yourself. Take care of your breath. The stronger the breath is, the healthier you are. And again, I will just keep on saying that medicines will do their job, but trusting your breath will give you miraculous results. Thank you.